The CDC reports that measles cases have hit a 33-year high across the country. More than 150 hospitalized, 3 have died, highly contagious. It was declared eliminated 25 years ago in the year 2000. Dr. Mark Siegel's got more on this, and Doc, good morning to you. Several months ago, we heard about an outbreak in West Texas. Is that connected to this, or what else is happening, Doc?
Yes, Bill, let me tell you how I put this together. We have about 93% uptake of this vaccine, the measles, mumps, rubella vaccine in this country right now. We need 95% for what's called herd immunity, where if you can't get the vaccine, you're protected by those around you. This is a wildly contagious virus. It's not the 93% number, though. It's that certain pockets, like what you mentioned in West Texas, there's a lower compliance rate. It might be in the 80s. But here's what's driving the problem, Bill, and here's the consequences. It's Europe. There's a huge outbreak in Europe this year, big increase, and that's because in Europe, the vaccination rate is in the 80s. So that's going way up. Travelers bring it here to the United States, and if you're not vaccinated, and of the cases we've seen here in the U.S., over 1,200, 92% of those are either unvaccinated or we don't know if they are. So it's unvaccinated people that receive it from travelers, and then it seeds here. And here's why it matters. Because elimination status that you mentioned is a signal for travelers from other countries that impacts how people look at traveling here. And that can cost us economically. We need to be on the global map as having elimination so people more freely travel here. That's what's at stake here.
Okay,
and that's what we have to drive is increase the vaccination.
Yeah, that vaccination is critical on this. I want to talk about another topic.
Hugely critical.
Yeah, MAHA, right? Dr. Mehmet Oz is making the case in the past 17 years, kids in America are just frankly less healthy, physically and even mentally. Here's Dr. Oz on that. Child obesity, watch here.
1 in 6 kids are obese. By the way, we have obesity numbers in America that are twice that of any other developed country. That's not just an accident. That's not genes. And heavy kids become heavy adults. But we also got a quarter of young men, teenagers who have ADHD. We've got a quarter of teen girls who say they've got big-time depression. These are massive shifts over a very short period of time.
Okay, Doc, line it up for us. Can the MAHA movement change those numbers?
I believe yes, and I believe everything he's saying is right. I think it's based on diet, lack of exercise, and one thing they haven't focused on yet is sleep. And a new study in the Journal of American Medical Association looks at just that. Sleep apnea, it leads to obesity, it leads to depression, it leads to anxiety, it leads to gobbling up pills, which the MAHA movement is against. If we get people, little kids, before they get sick, we're going to be able to fight the sick care system and go back to a health care system. Completely agree with Dr. Oz and RFK Jr. on this.
Thank you, Doc. Nice to see you today. Mark Siegel on both topics. Thank you, sir.
Good to see you.
All right.
Hey, everyone. I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.